Arnett, Fritz, and Bell begin their explanation of care as healthcare communication ethics protect and promote care, human caring of one another, in a professional context and in all contexts where decisions affect the quality of life, and all too often life itself. They delve into the importance of knowing the why care should be given and received before addressing the exact details of care. The first step towards asking a should question begins with a sense of why. In order to determine what should be done, the answer to why something should be done must be asked first. Healthcare communication ethics works with a good that gives us reasons to pursue health, endure recovery, and deal with the pain of life and death. Each individual in healthcare communication ethics must find a why to meet their challenges ahead. It gives us a sense of why that permits us to bear any how. Healthcare communication ethics centers on a good that gives us a why for seeking information, for seeking help, for a reason to fight, or for a reason to think about others in the final moments of our own lives. Healthcare communication ethics must be negotiated again and again to try to figure out the best response in a given moment for a particular person. To demonstrate this concept, let's look at the fact-based story of Hunter Patch Adams, the founder of the Gesundheit Clinic, a clinic which deals with their patients with humor and emotional appeal. In 1969, Hunter Adams was a troubled man who voluntarily committed himself into a mental institution. Once there, he finds that helping his fellow inmates there gives him a purpose in life. Thus inspired, he leaves the asylum and vows to become a doctor to help people. However, what he finds at medical school is a callous philosophy that advocates an arm's-length attitude to the patients that does not address their emotional needs or the quality of their lives. In our first scene, one of the adult male patients at the hospital is dying of cancer. He has scared all the nurses with angry outbursts, violent episodes of bedpan throwing, and worse. After weeks of studying the situation, Patch makes his first attempt to enter the room of the dangerous patient.
Preview of coming attractions.
There's
Death, to die, to expire, to pass on, to perish, to peg out, to push up daisies, to push up posies, to become extinct, curtains, deceased, demised, departed and defunct. Dead as a doornail, dead as a herring, dead as a mutton, dead as nits. The last breath, paying a debt to nature, the big sleep. God's way of saying, slow down.
check out.
To shuffle off this mortal coil.
To head for the happy hunting ground.
To blink for an exceptionally long period of time.
To find oneself without breath.
To be the incredible decaying man.
Worm buffet.
Kick the bucket.
Buy the farm.
Take the cab.
Cash in your chips.
And if we bury your ass up, we have a place to park my bike. Woo! Come on, it's shoot number 9. Ride that morphine pony. Come on now, boy. Yeah! Come on now, on now. Yeah, yeah. Let's check.
The entire hospital staff had given up on the bitter man. When the nurses did enter to check up on his vital signs, they left quickly and said as little as possible. Even though Patch had been properly warned to stay clear of the wild man, he wouldn't give up on anybody. The patient was suffering both physically and spiritually. Patch believed that everyone is an individual and needs a unique care program. In this next clip, Patch gives an impassioned speech before a tribunal of doctors about the right way to treat patients.
Will you define treatment for me?
Yes, treatment would be defined as the care of a patient seeking medical attention. Have you been treating patients, Mr. Adams?
Well, sir, I live with several people. They come and go as they please. I offer them whatever help I can.
Mr. Adams, have you or have you not been treating patients at your ranch?
Everyone who comes to the ranch is a patient, yes. And every person who comes to the ranch is also a doctor.
I'm sorry.
Every person who comes to the ranch is in need of some form of physical or mental help. They're patients. But also every person who comes to the ranch is in charge of taking care of someone else. Whether it's cooking for them, cleaning them, or even as simple a task as listening. That makes them doctors. I use that term broadly, gentlemen, but is not a doctor someone who helps someone else? When did the term doctor get treated with such reverence as, oh, right this way, Dr. Smith, or, excuse me, Dr. Scholes, what wonderful foot pads, or, pardon me, Dr. Patterson, but your flatulence has no odor. At what point in history did a doctor become more than a trusted and learned friend who visited and treated the ill? Now, you ask me if I've been practicing medicine. Well, if this means opening your door to those in need, those in pain, caring for them, listening to them, applying a cold cloth until a fever breaks, if this is practicing medicine, if this is treating a patient, then I am guilty as charged, sir.
Did you consider the ramifications of your actions? What if one of your patients had died?
What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency and, God forbid, maybe even humor?
With his speech, Patch wasn't just fighting for his degree. He was fighting for what was right and giving care to all people, but especially when treating patients. In 2017, James Mould examined the efforts to reform our healthcare and the differences between problem-oriented care and goal-oriented care. He asserts that while many efforts to reform our system are improvements, we will never truly get a supportive healthcare system without changing our whole approach. As seen in Patch Adams, the doctors, as our healthcare system, focus on the problems and tactics to solve those problems without looking at the uniqueness of each patient and what they need for holistic health. In Mould's study, he proposes that a goal-oriented approach would tie intervention directly to meaningful outcomes. This would enhance therapeutic relationships and improve patient support and adherence to care plans. Ultimately, healthcare would be more effective, less expensive, and more humane. As seen in both the movie Patch Adams as well as in Mould's study, the ethical aspect to healthcare communications rests on treating every patient as a unique individual and gaining their active participation into their own care. And all of it really rests by showing that you care.